I had a small mole in my clavicle that was raised, and my mother and girlfriend bugged me to go to the dermatologist. When I finally went, he told me that I was diagnosed with a stage 1B melanoma. I was 25 and just became a cancer patient, and I didn't really know what that meant at the time. I had surgery, we removed it, and as far as I was concerned, I went on with my life. 12 years later, I went to the hospital with what I thought was a spiking fever. The doctor took a look at my chest x-ray and my blood work, and he told me, with your history of melanoma and these spots on your lungs, I'm afraid you have a recurrence of your cancer. I looked at him, I told him I think he was crazy, he must have had the chart switch, but he was right. Spent 16 days in the hospital. When I left, over 2 weeks later, I had an 8-centimeter tumor removed from my bowel, and there were 4 other tumors spread between both lungs, my liver, and my spleen. My son was 4 weeks old. The treating oncologist told my wife that he'd be surprised if I were here in 2 years. When I heard that, it gave me motivation, that there was a small family that I was trying to raise that I needed to be here for. I finally found a clinical trial about 4 hours from our house, and it didn't work. The tumors got bigger. About 5 months after my initial diagnosis, I officially failed the trial. And I was looking for another hope that there would be a treatment out there that would give me a durable response. The second trial, almost immediately, you could see tumors shrinking. The first year of that trial went really well. My health started getting better. Just this summer, I had a follow-up PET scan and CT scan. That was the first official diagnosis that the cancer was gone. When you get diagnosed with cancer, it is an overwhelming thing. To be able to try to find the exact right treatment while dealing with your health, while dealing with all of the emotional and mental stress. I was fortunate that I was able to navigate that with a lot of assistance from other people. So part of what I do is try to get other patients through that process. With my blog, with a few other places that I've written for, to promote the message of find your community, find your town, find your people, and they will help you. There are people out there that have gone through this. A lot of us are very, very willing and able and passionate about helping today's patient, tomorrow's patient, next year's patient navigate their journey too.